medications that are not for considered to be cancer treatment. So there is a different approach to the 2020 drug list as compared to the 2016. But as mentioned, as mentioned, um, uh, we are still very much using the 2016 because 2020 has been provided for us as a draft for review. So these are the different groups under the NIOSH Drug List 2020. If you want, again, we can send you a PDF copy of the NIOSH lists version 2016 and 2020. But for the interest of time, I'm going to move forward with our next slide. All right, so let's go to risk assessment. When it comes to hazardous medications, um, uh, when we're dealing with this, there should be a risk assessment involved. So, how do we assess ourselves? If there are any practicing pharmacists in the participants list that we have today, or if there are any interns that are looking forward into the compounding practice, then I would like to implore you to think of this if you're going to that practice. Number one, please know the type of hazardous drug that you're dealing with. Are you tasked to prepare cancer medications? Are you tasked to prepare hormones, for example, because there are hormone drugs that can cause imbalances and therefore unwanted effects to our system? All right. So know the type of hazardous drugs. Another one would be, is that drug volatile? Can it turn into gas? What would be therefore the equipment that is present in the institution to protect me from these gases? Number two is the dosage form. So of course, dosage form, is it in tablet form? Is it in capsule form? Or is it a liquid, sterile liquid form? All those. Determining the dosage form would also help you in knowing what kind of manipulation is expected of you, and we will go to that later. Next would be the risk of exposure. Uh, Simply defined as if you're a compounding pharmacist for hazardous drugs, then you are at a higher risk of exposure as compared to a dispensing pharmacist, for example. And then next would be packaging. So please note uh, what are the proper how a drug should be packaged when it comes to the pharmacy. So there are studies that which have shown that volatile medications, for example, if they are in any way damaged during the transport into your hospital facility, those volatile medications can easily exit out of their bottles, out of their vials, and contaminate the carton boxes. And those boxes, if you do not have the proper training on dealing with hazardous medications and you don't use proper gloving technique, which is double gloves at least, um, uh, if you directly handle those boxes, then there might be dermal absorption that would happen to you. So it's prudent that you will be utilizing PPEs and you will be aware of what medications you are transporting from one place to another. So if there is a facility if a hospital has a facility used for hazardous drug handling, every personnel that will be um, uh, dealing with hazardous medications from transport up to disposal, they should be properly trained and they should be made aware of what they are dealing with. Number five would be manipulation. All right. So manipulation, basically, uh, how complex the process that you will be doing when it comes to preparing compounded medications. Like, say, for example, cutting a tablet in half. That's much easier as compared to preparing sterile solutions of these hazardous medications. There are a lot of steps definitely involved with that. And there are calculations that should also be done when conducting compounding of these hazardous medications. So know what are the proper steps, what would be the process when it comes to manipulating these drugs. So, routes of exposure. How can you be exposed to hazardous medication? Number one would be dermal absorption. So dermal absorption, as mentioned earlier, according to USP 800, there should be double gloving technique. At all times when you're dealing with hazardous drugs, please wear double gloves. All right, because again, these drugs, their characteristic is so unlikely that they can also cause dermal absorption. Inhalation of dusts or aerosols. Again, if you are transporting a hazardous drug medication directly and you don't have any equipment in place, you're just handling it directly, please utilize N95 mask. Accidental injection. According to studies, and according to the experiences of the fellow pharmacists that we have come in contact with, wherein we conduct discussions like this, it's very important that a pharmacist doing compounding of hazardous drugs is not doing so within an entire 8-hour shift, because sterile hazardous preparation is very complex, and the more the higher load of compounding materials, then there would be higher chances of accidental injections to occur. So there should be a maximum of 3 hours for a personnel to be continuously doing compounding of hazardous medications. Unintentional ingestion. So this is done if an operator does not know the proper SOP, even the proper washing of hands, for example, before and after doing the compounding. So it's very important that every personnel would be properly trained. And these routes of exposure, they are seen not only during drug preparation, but even during drug administration, handling of patient waste, transport and waste disposal, and even with the cleaning of spills. All right. So, what are the specific adverse effects that one can experience when it comes to handling hazardous medications? There would be the acute effects and the chronic effects. Acute effects meaning that, this can occur within a less than 6 month period, for example. If you are dealing with hazardous medications and you don't have the proper facility, you don't have the proper equipment, you don't have the proper PPEs and protocols in place, then you might experience one or more of the following. Number one, nausea, vomiting, and diarrhea. Headache and dizziness, hair thinning and hair loss. When it comes to this particular effect, and when we conduct this training on hospital pharmacists, they would always be doing checking their hair, the thickness, and some would say that they started compounding, they had very beautiful thick hair, and then after a few months, they would be joking that they're losing that particular gloss and thickness of their hair. Mucosal sores, irritation to the skin and the eyes, abdominal pain, nasal sore, sore throat, and even organ damage. Now, what's alarming is that the acute adverse effects of the hazardous drug accumulation in your body, it's similar to what you would refer to as a common cold and flu, but you don't know that there is already accumulation of the hazardous medications and probably some form of mutation happening in your body. The other side would be chronic, the chronic adverse effects. Now, if you don't have the proper facilities in place that I've mentioned a while ago, then even if you don't experience it now, after 3 months, after 6 months, um, uh, the medications, these hazardous medications, since they have an accumulative effect in your body, the adverse effect can actually come out 10 years from now, 15 years from now, and you're none the wiser. Chronic adverse effects can be in a reproductive form, let's say spontaneous abortion, menstrual dysfunction, testicular and ovarian dysfunction, premature labor, and infertility. That's why if there are compounding personnel and they plan to have a baby, for example, then they should directly go to their supervisor and be inform them of this so that they will be removed from that hazardous compounding facility to another much safer one. So we are removing any possible risks. Because again, these medications can also cause developmental effects to the fetus, for example. Genetic malformations is also possible, and organ damage, bone marrow suppression, and cancer like neoplasms and leukemias. All right, so I want to show you this particular slide so that you can imagine how how we should really be worried as well on the compounding personnel for hazardous drugs. Let's look into the patient profile. So a patient, let's say a cancer patient, um, uh, it would be he or she would be receiving a regimen that is evidence based already. So that regimen would be listing out what specific drugs should be used, what dosages should be used for a particular patient, what are the combination of medications that can be used, and how long should the treatment last, you know. So for the patient, the pros and cons we are well aware. How about for the healthcare worker? Now, a healthcare worker, let's say that the facility does not have the proper equipment, proper SOPs, protocols, all those that I've mentioned earlier, then that particular pharmacy compounder is being exposed to low doses of the medications that he or she is handling. And the pharmacist who is compounding is not only compounding one drug for one patient. As I've mentioned, a treatment protocol, it includes several drugs. So, and the practice lasts for over several years, not unless you go out of the compounding practice. So, over a few months' time, for example, the drugs that have accumulated within your body, because you're doing compounding, and you're not doing it properly, for example, it's accumulating, and it can cause unwanted effects like 6 months from now, even up to 10 years from now. And why am I saying this? Because there is a study already conducted by CDC and NIOSH. There was a case report about a 39-year-old pharmacist who suffered 2 episodes of painless hematuria, or blood in the urine, and was later on found to have cancer. Now, going into the medical history, 12 years before her diagnosis, she was working full time for 20 months in a hospital IV preparation area where she was preparing cytotoxic agents. And at the time, she was using a horizontal laminar flow hood. Now, a horizontal laminar flow hood is designed like this image above, wherein all the air from the unit, it will be exhausted horizontally. So if the pharmacist is using this in preparing hazardous medications, you can just imagine that all the drugs she was preparing, it was being blown towards her. So there's no contamination in effect here. This just goes to show that, yes, you have a wide range of equipment, but as pharmacists, it is also our job to know what kind of equipment should be used for a particular medication. So there are equipment are there, but they are designed in such a way to either ensure a sterile medication, or a sterile medication that is also protecting you, operator, from being exposed. So, of course, you may argue that we are all healthcare professionals here. A person can develop cancer not just by this particular scenario. Yes, there are a lot of parameters involved with a person developing cancer, but you cannot just say this is a huge no-no. I mean, she was working full-time for 20 months in a hospital, and she was using well, we can say wrong equipment in that case. So this is a very sad case, but let it be an eye opener for everyone that the guidelines USP 800 have been set here and prepared for a reason. All right. And because of that, USP 800, as mentioned, it definitely builds on the standards that was prepared by previously existing compounding chapters. So I would just like to focus on the objectives of USP 800 for a bit. So 800, since we're dealing with hazardous medications, the objective is to provide protection to the patient, to the healthcare personnel, and even the environment from untoward exposure to hazardous medications. And what are the different forms that hazardous drugs can take into or can be? So there are non-sterile hazardous drugs. They can be in the form of tablets, capsules, and ointments. So if that's the case, then there should the objective of your equipment, of your protocol, is to ensure that there are operator and environment protection. But if you are dealing with sterile hazardous drugs, so your intravenous medications, then the focus of your facility should be to provide product, operator, and environmental protection. So the hierarchy of controls. When it comes to hazardous medications, there should be three main controls that must be present in a facility so that we are ensured or guaranteed of protection to the operator. This is shown to be in an inverted pyramid. Inverted pyramid means that the one at the top is the most effective and the one at the bottom the least. However, they all must be used all together in order to obtain the best result. Number one would be engineering controls. What are these? This can range from your equipment, like your BSC and isolator, to your clean room. Administrative controls, the SOPs in place set by the institution that should be followed by the operators. Number three would be the PPE or personal protective equipment. Again, so I've been mentioning that USP 800 has been built based on USP 795 and 797, but we added the idea of containment. Because again, we want to contain hazardous drugs. We want to prevent exposure to the operator because we don't want unwanted or negative effects. So this is done through ensuring that you've got these elements in place. Number one would be facilities. Primary engineering controls or C, the C here in front means containment. Containment primary engineering controls. This is referring to your equipment like your BSCs and isolators where you are doing the compounding. Number two is your secondary engineering control, your clean room. Where will you be placing your equipment? Where will you do your compounding? According to USP 800, the clean room for that is used for hazardous drug handling should be away from common corridors that is being used by a huge traffic of patients and other healthcare workers. Supplemental engineering controls. What are your supplemental engineering controls? I'll show you images of that later. Other elements. Number one would be personal training and monitoring. Again, before a personnel is deployed in a compounding facility, he or she must have proper training. And actually, USP guidelines suggest that compounding personnel should be trained annually. Okay. Why annually? Because there are changes, possible changes to the guidelines of compounding, and there are possible changes to the data sheets or the profiles of the drugs you are dealing with. Number two would be medical surveillance. Now, before a personnel again is deployed in the compounding facility, there should be a medical check. So that we would have, or we would be guaranteed that that personnel is of it is of the best health, for example. And so that we will have a basis of that person's health status or profile. It is recommended that medical surveillance be done annually for the operators. And in any cases wherein an operator is not feeling well, he or she must immediately communicate this to the department head, and it is advised that a medical surveillance checkup be done to that particular operator again, so that we are removing any possible risks for that operator to develop unwanted effects, like cancer, for example, in the long run. So we want to prevent that. Number three is environmental monitoring. So we have to guarantee that the facilities we have are not being exposed to the hazardous medications. And number one prevention that to do that is to have an proper equipment in place and proper SOPs in place. PPE, what are the different sets of PPE? I'll show you later. Decontamination and cleaning, I'll show you in the next slides, along with the spill management. Okay, so the recommendation from NIOSH: preparing several intravenous doses of an antineoplastic drug typically poses a higher potential risk. So it is recommended that protective gown, double gloving, as well as BSC or khaki. What is khaki? Containment, compounding aseptic containment isolator. So possibly supplemented with a closed system drug transfer device. I'll show you images of this later, is very necessary to protect the drug, the environment, and the healthcare worker from exposure. All right. So these are just discussions on engineering controls. uh, what are the different engineering controls that we have? Primary engineering controls, this would refer again to your equipment. BSC isolator. Secondary, referring to your clean room. Supplemental, your CSTDs. So you can do a screenshot of this during this discussion. All right. So again, going into the containment primary engineering control, your equipment like your BSC and your isolators, they are designed to have specific airflow, specific cleanliness classification and pressurization, so that they will always be protecting both the operator, the environment, and the product from cross-contamination. So you can do a screenshot of this. For the interest of time, I would just like to go briefly into this. Airflow, when it comes to sterile hazardous medications, it is recommended that there is a unidirectional airflow in a single pass. Single pass means all the air that comes into the unit, 100% of that will be exhausted out. Recirculating, let's say 100% of air goes in, 80% recirculates in the unit, and then 20% to 30% is exhausted out. Airflow velocity should be zero point 0.3 to 0.5 meters per second, so that we are effectively purging the work zone from any contaminants. Cleanliness classification. Uh, USP 800 reiterates that it should be ISO class 5 if we are dealing with sterile medications. Pressurization. Uh, Positive pressure should be used if we're dealing with sterile drugs that are non-hazardous in nature, like your TPNs. Negative pressure is required for cancer medication preparation, or other forms of hazardous drugs. Filtration, so all equipment used for sterile manipulation of drugs are equipped with HEPA filters. So these are high efficiency particulate air filters that can remove up to 99.995% of particulates even at the zero point 0.3 micron size. Direct compounding area, basically where you are conducting the manipulation of the drug. So again, this should be ISO class 5. Venting or ducting, again, this should be done when dealing with volatile medications because your HEPA filters, again, are not designed to filter out gases. So the only way to remove hazardous gases within your work zone and your clean room would be to duct it out of the facility so that all air will be removed. Okay, so what are examples of the equipment that can be used for hazardous drug manipulation? So you've got your biological safety cabinets. As per USP 800, the equipment utilized for hazardous drug preparation should be exhausted out of the facility. Uh, and it should also have HEPA filters in place to guarantee the cleanliness of the work zone. However, this would depend on what are the characteristics of the drugs you're dealing with. Class 1 BSCs are designed more for non-sterile hazardous drug handling. Class 2 BSCs like your A2 and B2 are designed for sterile hazardous drug handling as well. So A2 just means that there is a specific amount of air recirculating within the work zone, but you don't have to worry because before that air goes into the work zone here, it is filtered through HEPA filters. And the class 2 type B2 means that 100% of the air is exhausted out of the unit. There is no recirculation happening within. All right, so I'm just going to skip through these next slides. These are more for discussions on details of the BSC, but for the interest of time, I will skip this. But you are more than welcome to do a screenshot of this. Okay. Um, BSC Class 3 is also indicated for hazardous drug handling. However, an isolator is more common in hospital compounding facilities. So why is that? Let's look at a BSC Class 3. A BSC Class 3 is designed like this. So you have glove ports. It's also a fully enclosed system. But the thing is, BSC Class 3s are more designed for biological handling, for BSL handling. Reason for that are these are designed to be about negative 100 to negative 125 pressure inside. So it's more for BSL containment. For an isolator, I've shown you an image earlier. It looks like this, but there are specific changes. For example, let's look at the main application. According to EN 12469 and NSF 49, a BSc Class 3 is more for microbiological agent handling, while isolators are specifically mentioned by USP 797 and 800 for pharmacy compounding, even of chemotherapy drugs. Pressure configuration. BSc class 3, it's very highly negative, even up to negative 275 pascals. An isolator, however, it can be designed to be either positive or negative, depending on the application. Airflow configuration, BSc class 3, always in total exhaust. Isolators, it can be total exhaust, it can be recirculating as mentioned earlier. Pass box for the BSc, it means this little box here where you can allow material entry and exit. It's static. It means there is no air here. But for isolators, even the pass box or pass-through chamber has airflow because, again, we want to ensure sterility of the work zone. Okay. Glove material, BSc Class 3, mostly neoprene, handling of different chemicals, for example. Isolators, it's usually hypalon, which is designed to handle any sort of drugs. For example, it will prevent possible dermal absorption of the drugs. All right. So another form of equipment, just going through here, is your containment, ventilated enclosure. Again, this is according to USP 800. This is more for dealing with potent powders, so hazardous powders that are not sterile. CYT cabinet, just going through here, this unit is equipped with 3 filters, one filter for the downflow, one HEPA filter for the exhaust at the bottom of the work zone, and another exhaust HEPA filter at the top. So this is designed based on Australian guidelines. So different countries tend to have different compounding guidelines, but for some countries, like say for example Malaysia, Philippines, they tend to follow either USP counterparts or the European counterparts. Another example of the equipment is isolator. So as mentioned, it looks something like this. So it's a fully enclosed system. Uh, um, uh, the pass-through chambers shown here and here, they have air as well to purge out contaminants. Okay. Environmental factors. So I would just like to give a bit of a trivia here. I'm so sorry. I think we're going to extend a bit, but only a bit. Sorry for that. I would just like to mention what is the differences between cleanliness classifications. So as pharmacists, I am sure that you have an idea or well aware of what ISO class 5, ISO class 3 would generally be. For United States Pharmacopoeia, when it comes to sterile drugs, they would always mention ISO class 5 to be the air quality. So ISO class 5 just means that you have only 3,520 particles present in per cubic meter of your space. It makes it generally very, very clean. And as you go down 5, 6, 7, 8, you can see the particle count allowable increases in number as well. So ISO class, these terminologies are more commonly seen in the United States guidelines, in any guideline under the United States provision. However, there is also grades A, B, C, or D. And as you can see, grade A, 3,520 allowable particles, this is similar to your ISO class 5. However, the grades A, B, C, and D categories, they are more commonly used in European guidelines. So for example, you go to Malaysia. In Malaysia and in Taiwan, they would opt to use the terms grades A, B, C, or D because they are more keen on following PICS guidelines or any European GMPs. For the Philippines, however, for example, they are more keen to follow USP guidelines. So they would be more familiar with the term ISO class 5, 6, 7, and 8. Okay. Again, these are just some photos of isolator systems, different types. But how would you know which pressurization is the best for what type of drug handling? So for non-hazardous compounding, TPNs, for example, you can have a positive pressured isolator. However, when it comes to chemotherapy drug handling, it should already be in a negative pressure. If you're dealing with hazardous drug handling that may volatilize, then it is recommended for you to have a negative pressure in total exhaust airflow regime. Okay, so these are just more on filters and different parts of an isolator system, but I would just like to skip through this and jump into the secondary engineering control. Now again, your SEC is referring to the room where your equipment, like your isolator, will be placed at. This is your clean room. According to USP 800, your BSCs, as much as possible, they are recommended to be placed inside an ISO class 7 clean room. But for isolators, if you have an isolator, then it's okay for you to not have a clean room area. The term is containment segregated compounding area. So it's not a clean room. However, there should still be parameters in place. What are those parameters? There should be 12 air changes per hour. But as you can see, it's lesser than the air requirement for an ISO class 7 clean room, which is 30 air changes per hour. And this would be one of the reasons why facilities would opt to have isolators, because then the operation cost would be lessened, because they are not obliged to have a clean room like ISO class 7, 6 or higher. Okay, now let's go to supplemental engineering controls. These SECs are an additive, an additional control that can be used if you have an equipment or clean room in place. So these are examples of your CSTDs. These are used for compounding and during administration of hazardous medications. However, these equipment are also very expensive. But if the hospital, for example, has a budget for CSTDs, then they would opt to have this. Again, these CSTDs, they are normally requiring FDA certifications or Food and Drug Administration certifications. And if you purchase this, if you're in a hospital setting and you purchase this, then the source or the manufacturer should train you on how to properly use them. Okay, administrative control, the SOPs in place. So there should be a hazard communication program present in the facility, occupational safety program, designation of areas for hazardous drug receipt, storage and compounding, dispensing, administering, transport, and disposal. So you can do a screenshot of this. Use and maintenance of proper engineering controls, hand hygiene and proper use of PPE, and I'll show you later and some cleaning steps. So personal protective equipment, when should it be used? So you should have PPEs if you are handling hazardous drugs, even if it's just receipt, storage, transport. Compounding, of course, administration, definitely. Even the cleaning of the equipment, the clean room, and spill control cleaning, you should have proper PPEs in place. What are the PPEs? Number one, gloves. Now, it is recommended to wear double gloves when doing hazardous drug handling. The USP 800 specifies ASTM D6978 certification or testing of the gloves. Now, there are manufacturers of gloves that are used for hazardous drug handling, and in their coverings, in their materials, there should be this ASTM D6978 certification. But we are not obliged to follow this. Again, this is just the recommendation. If it's not readily available within the facility, for example, then double gloving would be enough. Please ensure that the gloves are powder free, because we want to ensure sterility of the product. And it is recommended to always check for pinholes before utilizing those gloves when doing hazardous drug compounding. Gowns, again, they must be chemotherapy gown and sterile. So you can do a screenshot of this. Head covers, of course, properly placed and ensure all hair is captured. Shoe covers, of course, this is done or used if you are entering a clean room space. So proper SOPs should be there. Eye and face protection, this is mostly used when dealing with spills or cleaning spills. And for respiratory protection, a NIOSH certified N95 mask if you're handling drugs directly. Sleeve covers are also used, especially if the facility does not have, like, let's say, an isolator, they have a BSC, for example, so they would opt to have additional sleeve covers as additional protection. And disposal. All personal protective equipment that is used for hazardous drug handling, please do not reuse them. Once they are used, they are already considered as contaminated. So if you are leaving from the facility where you did compounding of hazardous meds, please remove all your PPEs. And then if you're going to enter again, like let's say for the next shift, wear new PPEs. All right. So what are the different steps of cleaning and decontamination? I would urge you to take a screenshot of this. But mostly this is for facilities or hospital institutions that conducts uh, uh, hazardous drug compounding. But there should be 4 steps in place. Okay. Deactivation, number one, because it's very, very hard to deactivate hazardous medication. There is no one reagent that can deactivate all. So please check the material safety data sheet of each hazardous drug that you are preparing. It is recommended that a hospital institution would do that. Decontamination, so once you finish deactivating it, the equipment, the BSC or the isolator, you do the decontamination wherein you remove inactivated residues. Number 3 is cleaning. Remove organic and inorganic material. Now you can just use sterile water or germicidal detergent here. Lastly would be disinfection wherein you're destroying microorganisms, and you can use sterile IPA or alcohol for this step. So I would also urge you to take a screenshot of this particular slide. These are basically what are the 1 to 3 steps of cleaning your equipment when you're doing hazardous drug preparation. Now, please take note that reagents used for deactivation, decon, for example, they are very, very expensive. And it is not recommended that you do these 4 steps of cleaning in a day-to-day basis. This would depend on the protocols in place set by the facility. Normally, what we would hear as a practice would be they would take one day in a week, let's say Sunday every week. They would do these 4 steps. But during Mondays to Saturdays, they would just do wipe down of the equipment that they have with sterile alcohol. Okay. But again, please ensure that there will be at least twice a month of cleaning using these 4 steps. Now, what is the reason that I'm saying that? Main reason is alcohol is not a deactivating agent. And there are a lot of institutions who are only using alcohol to clean their equipment. And that is a huge no-no. Alcohol can be used to clean after you compound a batch, for example. Or again, Mondays to Saturdays, you can use alcohol to clean, but there should be a designated day wherein you will utilize those 4 cleaning steps. These are some SOPs or schedules that can be used by hospital institutions when it comes to maintenance of their engineering controls. So you can take a screenshot of this. This is for open systems. The next would be a recommendation for maintenance of closed systems like isolators. Okay, next would be spill control. No worries, we are almost done. So for spill control, again, there should be a clear policy on the personnel that should respond when there is a spill. Because otherwise, it would be a cause of commotion. And we don't want that, especially in a hospital setting. It is recommended, therefore, to have a spill drill that will involve multiple departments so that everyone will know what to do. Spill kits as a form of spill control should also be present in the facility. You can take a screenshot of this. This should be the contents of a spill kit in a hospital compounding setting. Next would be spill control. This is an example scenario. What if a patient or a staff member has a contaminated clothing of hazardous drug? The first step would be removal of that contaminated clothing and immediately wash that skin and contact with soap and water for 20 minutes. If the user has been splashed in the eyes, please rinse it with water for 15 minutes via eye wash or eye bath. And then for disposal, again, disposal of all hazardous drug waste must comply with all applicable federal, state, and local regulations. Even personnel doing the disposal should be properly trained. There are countries specifying the colors of the garbage bins or the garbage bags for particular use for hazardous drugs. So, in a hospital setting, they should be well aware of that. Most hospitals as well and other compounding facilities, they utilize third-party companies to do the incineration of the hazardous drug wastes. Okay, so these are just some summary of the things that we've discussed earlier on. Again, compounding is an essential field in the pharmacy practice. We've got different sets of USP guidelines in place, 795, 797, 800, even 825. A hierarchy of controls. We've discussed the sterile non-hazardous drug compounding objectives as well with the sterile hazardous drug handling objective. Different sets of equipment, and employees or personnel doing compounding can help minimize their potential exposure to hazardous drugs by staying current on the knowledge of the occupational risks and ensuring that their work practices follow the best current recommendations. Again, USP 800 is here to guide us. We are not obliged to follow them, as is what is happening in the United States, for example. But it is best to review the different sets of international guidelines present nowadays, especially if we are planning to go into the field of hospital compounding. So I would just like to leave everyone with this quote: the wealth of a nation will always be its people. So thank you so much for being with us this afternoon. And if you have any further questions with regards to the topic that we had, please unmute yourselves and then we can have a good discussion. Thank you so much.
I hope that you had a great time. Just a small favor, kindly turn on your camera so that we can have a class meeting.
Okay, we would like to invite everyone to please open their cameras and join us for photo shoot, virtual photo shoot. Hi everyone, good afternoon. Thank you. Okay.
Thank you all.
Okay. I'm seeing a chat by Dr. Rajan. Yes, I will be sharing the PDFs of the NIOSH lists. However, I believe we can share a copy of this presentation of, I mean, of this video we recorded the discussion that I did for this afternoon, and I think we can try and share this video with you, sir, with you, doctor. Eshan, please help me with ensuring that we will share a copy of this
Sure,
meeting.
sure, sure.
Okay. So thank you everyone for opening your cameras. I'm doing print screen on my computer. Thank you so much. It's a lovely. Have a lovely day, everyone, and I hope to be able to cross the border soon, and we can have a discussion in person, hopefully soon. So thank you. Have a great day, everyone. If you have any further questions, you can chat here or you can send a quick message to Mr. Eshan here.
Sure. Thank you, everyone.